네, 오늘 8번째 디지털헬스케어 오픈 세미나에 오신 걸 너무 환영하고요. 뉴욕 주립대의 시모나 권 교수님을 모시게 됐습니다. 인트로덕션을 소개해드리도록 하겠습니다. Simona Kwon is an associate professor, director of the section for health equity, and the vice chair for diversity, equity, and inclusion in the Department of Population Health at NIU Grossman School of Medicine. Dr. Kwon is socio-behavior epidemiologist with extensive knowledge experience in the use of community-based participatory research, mixed method approaches, health communication, dissemination and implementation science, and multidisciplinary teams to address community-level health disparities. So Dr. Kwon employs a social determinants of health framework to implement and evaluate evidence-based strategies in community settings, focusing on cultural relevance and impact and identifying effective channels through which to translate research into practice. So we are very honored to have Professor Kwon from NIU, and she's gonna talk very interesting topic today. So hopefully you gain a lot of insight from this talk, and also please bring a lot of questions after her talk. So let's welcome Dr. Kwon.
Thank you very much, and thank you to Hanyang University and the Digital Healthcare Center for this invitation to speak at your 8th Open Forum, all the way visiting from the United States to share my work. So I will start by defining some principles on health equity and digital equity frameworks. I will share 2 examples of some of my work that focus on using digital platforms and electronic medical records solutions for low-income immigrant populations in New York City who experience language barriers. The focus will be on Chinese American populations. The first study is a participatory approach to developing a web-based app for Chinese American patients to access in-language, culturally tailored early childhood mental health resources and information. And the second study is on co-developing electronic medical record-based tools with doctors and patients on gastric cancer prevention. And I'll end with some key recommendations on how to use an equity focus for digital health interventions. So I'm going to start by sharing some of the methods and frameworks that guide my work. Okay, so my name is Simona Kwon. I'm an associate professor at NYU Grossman School of Medicine, and I'm a social and behavioral epidemiologist, and I focus on health disparities research and population health. I studied public health in graduate school. It was mostly statistics and looking at data, so just understanding percentages of who was affected with an illness and what was happening. But I was very dissatisfied because I wasn't actually doing interventions and changing health outcomes for patients. And so I really wanted to understand, how do I make a change? How do I develop a program to address bad health outcomes? And so that's when I started to study actually intervention research and how to do research in partnering with patients and communities and doctors so that we're developing programs that don't happen just in the hospital setting, but in communities. And I thought that was a very important thing because people need to be healthy wherever they're at, and it shouldn't be only when they come to the hospital. So that was really my driving force. Oh, my final goal as a researcher. Wow, that makes me sound like I'm at the end of my career. I feel like I'm still at the middle of my career, but I always want to make sure that I'm doing research that affects change. I don't want to do research just to identify a problem, it really is important for me to understand what the solution is and making sure that solution is integrated and implemented and that it works for everyone. And so my goals are always to make sure that all populations are healthy. I want to make sure that we're developing programs that are sustainable and that are continue to work, not just doing research, but really important change. I never want to do research just to do research. That's why the evaluation process is such an important part of the research. It's not just identifying what the problem is and what the solution is. It's about everything always changes. Like COVID changed everything, right? So it's really important for me to implement programs that last, and so it always has to be monitored. Everything needs to change, and so everything needs to be flexible. So that's something that I think is very important in the type of work we do. It's not just research. I think it's really important to tell the government or funding agencies that if you don't fund research for populations that experience health disparities, it ends up costing the government much more money because they become much more sicker. You save money in hospitals, save money, and the government saves money if everyone is healthy, and the people that are the unhealthiest are going to cost the government the most money. It's that economic piece that is very important to make sure to explain. If everyone's healthy, then it's not a burden to the healthcare system. Yeah. Thank you, everyone. Yeah.